Hi, I'm Dr. George Ampat. I'm a consultant orthopedic surgeon and work in Liverpool, United Kingdom. I want to start by asking you a few simple questions. Do you have hip or knee arthritis? Are you waiting for a total hip or total knee replacement surgery? What if you could reduce your hip and knee pain, improve your mobility, and even avoid surgery just by moving the right way? Does it sound too good to be true? Well, it's not. I've explained exactly how this is possible in my new books, Help for Hip Pain and Help for Knee Pain, both of which are part of the Free From Pain series. Let's face it, arthritic pain is frustrating. It slows you down, it makes everyday things harder, and it robs you of the simple joy of movement. Look at the gentleman taking a gentle stroll through the city center. He's enjoying the day until suddenly the pain strikes. Sharp, unexpected, and immobilizing. He pauses, grips his knee, and gently massages it, seeking some relief. This isn't just discomfort, it's the daily reality of living with knee arthritis. Most people in pain are told one of two things: take painkillers or wait for surgery. But what if I told you there is another way? As a surgeon, I've come to believe something surprising. The best surgery is often no surgery at all. Because pain isn't always caused by wear and tear. Sometimes it's caused by weakness and underuse. Let us look at the real cause of pain. Here's the truth. When we stop moving properly, our muscles weaken. Our balance deteriorates, and the brain loses the feedback it needs from our joints. Especially with hip and knee osteoarthritis, this feedback loop breaks down. What is the solution? Movement. The right kind, at the right level, with the right mindset. And that is why I created something called the ARISE plan. ARISE plan. What is the ARISE plan? Let me break it down for you. A is for awareness, helping you rebuild your joint feedback, balance, and body control. R is for resistance or strengthening the muscles that support your joints. I, that's you. You are the center of your own healing. S, stability, posture, core strength, and alignment. E, essential movements so you can stand, sit, and walk with confidence again. This is not just a list of exercises. It is a 12-week plan backed by science and years of clinical experience. And the best part, you did not need to go to the gym. Your lounge becomes your gym. You also do not need any costly devices. Just a chair and a few other minor pieces of equipment which you can easily purchase in a sports shop or from Amazon, and a little commitment. Inside these books, you will learn the difference between osteoarthritis and inflammatory arthritis, why pain doesn't always mean damage, how to break the vicious pain cycle and build what I call the victorious cycle, 12 safe, effective exercises you can do right at home, a weekly exercise and pain tracking sheet, and QR codes to follow along with video demos. Following the QR codes will take you to the specific exercises on YouTube. Let me show you an example. Let us look at the particular page in the book. Scanning the QR code on the page takes you to the specific exercises. In this case, the front knee strengthener. You need to point your smartphone camera to the QR code in the book. Immediately, a link appears within your screen. The link looks like something like this. Click on that link and it will take you to that exercise on YouTube. So you're never guessing. Exercise 6, front knee strengthener. Sit comfortably with the knees bent and feet flat on the floor. Apply the ankle weights to both legs. Slowly straighten the left leg. Once the leg is fully straight, slowly bend it, returning to the starting position. Lift up on a count of 2 and return to the original position on a count of 3. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 6, front knee strengthener, level 1. 5, 4, 3, 2, 1. Swapping legs with the other one. 5, 4, 3, 2, 1. You're always supported. Let us now look at how neuromuscular exercises work. It is important to note that knee and hip arthritis don't just affect your cartilage. The arthritis affects the joints in the nerves in the joint. When the nerve is affected, the brain loses the ability to sense what the joints are doing or loses the ability to understand the position of the joints. This sensation is scientifically called as proprioception. We all require proprioception. When my fist is clenched, I do not need to look at my hand to know that my fist is clenched. The position of the joints and ligaments make my brain recognize that my fist is clenched. This sensation is required in day-to-day activities. As I walk, and when my left foot lands on the ground, a million impulses are sent to the brain about how the foot landed on the ground. The brain analyzes that information and then modifies the way my right foot lands on the ground. In that manner, my balance is maintained and the feedback from the joints allow us to modify our each step. When we have arthritis, that sensory input from the joint decreases. That is why patients who have arthritis complain that their joint gives way as they walk or when they exercise. The solution is not to stop exercising, but to exercise in the right way to increase both the strength and also to regain the sense of proprioception. That is where neuromuscular exercises becomes very useful. Let me show you an example. Look at this lady who's trying to do some country walking as part of her exercise routine. Unfortunately, the hip gives way and that causes excruciating pain in her hip and halts her in her tracks. That is why we use neuromuscular exercises. Neuromuscular exercises improve muscle strength, balance, joint control, and pain levels. One of my favorites, slide exercises. Let us look at the page from the book which provides a slide exercise. Scanning the QR code takes you to the slide exercises. Watch this backward slide exercise.
Exercise 1. Backward lunge. Level 1. Stand behind a chair facing forwards. Hold the back of the chair with both hands and look straight ahead. Place the sliding disc underneath the left foot. Bend the right knee and the right hip and lower the body by a few inches while sliding the left foot backwards in a straight line. Then return to the original position by standing up and bringing the left foot forwards. Repeat 5 times. Swap and alternate legs and repeat 5 times. Exercise 1. Backward lunge, moving the left leg. 5, 4, 3, 2, 1. Swapping to the other side and moving the right leg. 5, 4, 3, 2, 1.
In this exercise, when the foot gently glides across the floor, it is giving our brains real-time joint feedback, while also increasing strength. The joint feedback over a period of time improves our balance and the hip or knee doesn't give way. This can also decrease the chance of us falling. Neuromuscular exercises has been extensively used in Denmark. It is called the GLAD program. GLAD is Good Life with Arthritis Denmark. They have had real success, so much so that Canada and Australia have followed their example. The ARISE plan is similar to the exercises in the GLAD program. Let me show you some of the benefits from neuromuscular exercises. In a research study of prehab before total hip replacement surgery, 40% of patients who were listed for the surgery did not need the surgery for up to 2 years while they were having prehab. In another research study of prehab before total knee replacement surgery, 68% of patients who were listed for surgery did not need the surgery for up to 2 years while they were having prehab. So what can this book do for you? Help for hip pain and help for knee pain can help you with 1. Powerful metaphors and illustrations that clarify complex ideas and inspire you to exercise. Number 2, stay motivated with evidence-based explanations. Number 3, rebuild your strength and coordination. Number 4, manage pain naturally. Number 5, decrease the need for painkillers including opioids. Number 6, prepare for surgery if needed. This is called prehabilitation or prehab. 7, in some cases avoid surgery altogether. 8, and finally offer real solutions if surgery isn't an option. This is more than an exercise guide. It is a roadmap to taking back your life. Who is this for? Whether you are waiting for total hip or total knee replacement, living with arthritis, or just feeling stiff and sore, this book is for you. And if you are unable to purchase it, you can find all the exercises for free on my YouTube channel. Because my goal is simple, to help you live free from pain. So if you're ready to take your health into your own hands, if you want to reduce your pain from arthritis and start moving again with confidence, grab your copy of Help for Hip Pain or Help for Knee Pain, available now on Amazon or at ampat.co.uk. Start today right here with the free exercises on this channel. You are not your pain, you are your potential. Let's arise together. If you found this video helpful, please like, subscribe and share this video with someone you know who's struggling with joint pain. Thank you so much for watching. See you in the next video, and as always, stay free from pain.